wanted to go through a return to run assessment that we look at. We especially do this with both people that would like to start running or anybody that comes in and is looking to return back to running. We also use this, or at least I like to use this as well as for a general assessment with potentially looking at where there's dysfunction in the running body itself, or when we're looking to add a specific strength program in to attack any of the deficits that we see with people. So what we're trying to do here is we're just trying to get a general assessment of what the body can and can't do. We want to stop if there's any pain. We want to note if there's any pain for sure. We also want to just know where there's general tightness when we do this movement to find the specific restrictions when we do the certain movements. So the first one we're going to start with is a simple, is the patient able to touch your toes? We're going to bend down. We're trying to keep our heels in the ground and come on back up. Come on down and up. So for me personally, I feel a lot of tightness in my hamstrings. So we would mark that and then we would move on to the next exercise. The next movement that we're going to do is a simple back bend. So hands at our hips and we're just going to bend back. Can you do it? Do you feel any pain with that? I'll also show on the side. Can you do that? Is there any pain? Do you have any tightness? Can they do that? The next one, the third one, is a simple rotation that'll actually turn to the side so you can see me rotate. Rotate as far as you can. Is there any tightness? Is there any tightness? Is there any pain with that? Again, for both of these, I would mark thoracic tightness in my mid back as well as in my low back as well as hips. And then we mark that and then we continue to move on to the other two. The third movement that we look at is single leg balance. So what we're going to do is we're going to have our arms at our side and we're just going to balance on one leg. We're looking for any pain and we're trying to balance here for 10 seconds. So once we do that, we switch to the other side. Again, looking for any pain, any weakness, any wobbling going on. Where is it coming from? The last one that we do as a part of the movement progression is we're going to look at the squat itself. So what we want to do is we want to have our arms crossed, feet are shoulder width, maybe a little wider than shoulder width, and then we're going to squat down. Come on back up. Is there any pain with that? Is there any tightness? Squat down. Come on back up. I'll show from the side. Squat down and back up. So we're going to look at all of those on video as well as in person. After we go through the movement assessment, we're then going to move to the strength and stability segment and assess what the body can and can't do. So the first movement that we're going to look at with the strength and stability portion of the return to running assessment is we're going to look at a bridge. I'm looking for, when a patient does this, or we're going to do it on myself for the sake of this video, can I hold that single leg balance position in that bridge, or does my core rotate? Do I have any pain with it? We're going to mark it, note it, and then we'll move on to the next stability portion. So we're going to start with the bridge here. Ideally, you have your arms crossed and you bridge up, legs straight. And then we'll switch. The second one we're going to do is a side plank. And we're going to do that on both sides. Really what we're looking for is, can you do that? Can you hold that position? The third one that we're going to do in the strength and stability portion of the return to running assessment is a single leg sit to stand or a single leg squat. What we're looking for is side to side deviation. Can the person do it without their knees touching? Is there a lot of wobble? Do we lose our balance? And what we're going to try and do is do 7 of them on both legs. I'll demonstrate with the left leg here. The last one we're going to do is a calf raise, and what we're going to do is we're going to start by pushing up with both feet with someone examining how you're doing. You're going to measure how high you can get, and then you're going to try just one leg, making sure you can get to that same height. And we're going to try the other side, and then you'll measure that, see if the patient can do it. I already know that on my left ankle, for me personally, it's harder for me to get up. We're dealing with some other Achilles problems right now, so for me, I would mark as unable. Then we would address that limitation and dive deeper into it once we can assess the rest of the body. The next segment that we'll move to is the actual foot and ankle mechanics, and then from there we have a huge picture of what we can and can't do. So we'll move on to the foot and ankle next. The last part of the running assessment is to look at the foot itself. So we'll look at my left foot because it's the one that I have my sock off on. And what we're gonna first try and do is we're gonna try and splay the toes. Can you do that without moving your big toe? Now I can kind of do it on one in my pinky toe, but I really can't do it on the other ones. So for this, we would mark unable. The second one that is really important to do is we wanna see, can you lift just your big toe independently? Now I have a hard time doing that. I have to bring all my toes up. So we would again mark unable to in this position. The third one, can you abduct, bring your toe to the side? And we kind of have it, but nothing fantastic. And again, for the sake of this video, we would mark all of these unable, and then we would add specific corrective exercises to address this limitation. Now the third one is we just want to look at ankle motion, and because I'm doing this myself, we're going to do it myself. Ideally, you have a practitioner who's doing this assessment on you to be able to go through all the ankle motions. We're going to come up, we're going to measure, see where that's at, push down, is there any pain, is there any limitation? We're going to look at eversion, inversion, as well as we're going to look at the actual mobility of the ankle itself. So again, this is the foot portion. We're going to add corrective exercises specific to how we do here. And then we're going to move on. When we get all of this information, we're going to put it all together and add specific corrective exercises. Now, once we have all this information on the foot itself, this wraps up our foot portion of the assessment. Now, once we have all the information from the movement portion of the video, from the strength and stability portion of the video, as well as the foot portion of the video, from here, we're gonna go through, we're gonna break down each of them. We're gonna find out which ones are the most efficient or which ones we're having the most problems with. We're gonna dive deeper as to why. Is it a strength issue? Is it a stability issue? Is it a movement issue? And then from there, we're gonna add specific corrective exercises to incorporate into someone's daily program, as well as their strength program, to improve their current running readiness ability, as well as getting them back to running the way they want. Now, this movement was just a general movement screen. Typically, people come in with specific issues, so what we're gonna then do is dive deeper into why those issues are gonna be caused, because we can go through a running assessment on a treadmill, we can break that down on video. This was just a general movement screen that we use at the beginning or end of every treatment session. This is just a general movement assessment that we use to make sure that people are prepared to return to run, as well as give us an idea of where our deficiencies are to make sure that we are as safe as we can be when we do return to run. Thanks for watching, everybody.